Good evening, everyone. This is Dr. Diwakar here, consultant nephrologist from KIMS Hospital, Secunderabad. And now we'll be talking about some important topic, a basic topic on how to understand pedal edema, what we commonly say it as swelling of limbs, swelling of feet. Next, in this today's session, we'll discuss what is pedal edema, how it is caused, what are the various reasons of it, how to identify the various reasons, how to diagnose, how to treat depending on the cause of that swelling of feet or pedal edema. Before coming, before understanding what is pedal edema per se, first what we'll know is what is edema actually. Edema is nothing but technically, medically, we label it as edema, but common layman term is called as swelling. If there is swelling of a body part, whether it is limbs, whether it is face, whether it is the abdomen, stomach, we'll call it as edema. It can occur because of various causes, medication, pregnancy, heart disease, kidney diseases, something like liver disease can all cause edema. And it depends on the cause. When it is identified, it can be treated. And now let us discuss in detail about edema now. Mainly pedal edema. Pedal edema is swelling of feet and ankles because of abnormal buildup of fluid in the space, in the subcutaneous space, that means just below the skin. Usually, it can be very mild when you travel for a long time. That is called orthostatic pedal edema, which is common when you hang out your legs for a long time. There will be swelling after 2 to 3 hours of journey. If that pedal edema usually disappears as you move on. Next, coming to very serious causes, it could be various like heart disease, kidney disease, liver problems, everything. And there are several factors which decide how much the pedal edema would be and how severe it would be. Next, moving on to the causes of pedal edema, it could be because of various causes which are very common in our day-to-day life, and if early identified can be rectifiable. The most important is being overweight, because excess body mass causes fluid retention in the feet, lower limbs, ankles, and this is because of decreased circulation of blood from lower limbs to the heart. Standing and sitting for a long period, this is very common when you travel in a bus for more than 4 hours, when you travel by a car by more than 4 hours, or if you travel by air for a long time. This happens because legs being in a dependent posture, there will be decreased circulation of blood from the legs into the heart because of no movement, no muscular activity, and they tend to be swelling of feet because of retention of fluid in the subcutaneous tissue. That means from skin to the bone. And next common cause of edema, usually unilateral, would be deep vein thrombosis or clot in your blood vessels of lower limbs. This can also be because of a prolonged journey. When you sit for a long time in a train, bus, or a flight, if you don't move your limbs for a long time, there can be a clot in your blood vessels, which decreases the blood flow from the lower limbs to the heart, which results in edema of that limb. Usually it is unilateral. It can also occur bilaterally on both lower limbs. Next common cause would be injury or infection. Injury or infection to the leg can cause swelling of that part of the leg, which leads in pedal edema. It is usually unilateral. That means a single leg is injured or single leg part of a leg gets infected. Then there can be swelling of that feet. Next is venous insufficiency. In some medical causes, there is decrease in the flow from lower limbs to the heart because of insufficient venous valves or ineffective venous valves where the blood flows in a reverse direction, decreasing the blood flow to the heart, which causes congestion of these blood vessels in the lower limbs and causes again pedal edema. Next, more common, more specific cause of swelling of limbs is pregnancy. We call this condition in medical terms as preeclampsia, where women becoming pregnant tend to have swelling of both lower limbs as the pregnancy goes on. Usually, in the 8th to 9th month of pregnancy, they tend to have swelling of both lower limbs, which gradually increases. And this is associated with increased blood pressure. And this we medically term it as preeclampsia. More specific is cirrhosis of liver, which is again a condition affecting the liver where there is decreased synthesis of a protein called albumin in the body, which helps to hold the fluid in the blood vessels. Because of decrease in albumin, the fluid is seeped from the blood vessels into the interstitial tissue, causing pedal edema or swelling of lower limbs. Congestive heart failure. This is one more condition where we medically see these people who are having heart disease tend to have swelling of both lower limbs, causing pedal edema. Next, related to the kidney diseases. Kidney diseases are varied where some people tend to lose protein from their urine, causing swelling of both lower limbs. That is usually associated or related to swelling of their face, swelling of entire body also. For some patients, there could be another condition as renal failure or chronic kidney disease, where these patients tend to have swelling of feet, which gradually increases. Next is an inadequate lymphatic drainage. Inadequate lymphatic drainage is a term where we commonly see is the filariasis, where this because of filariasis there is impairment in drainage of lymph, a fluid seeped into the interstitium into the blood circulation. This is called filariasis or ineffective lymphatic drainage. Next, very rare nowadays, uh, and very common earlier was because of very low protein intake, which commonly we call them as kwashiorkor, where there is decreased protein intake of children, mainly affecting the growing child, where they tend to have swelling of feet, both lower limbs, swelling of abdomen, like and swelling of face. And how do I identify pedal edema then? It is simple to identify pedal edema. It is like swelling of both lower limbs, where you can see you lose the veins which you can see on the lower limbs. There is skin stretching, there is glistening of the skin. When you press on the skin, there can be a dimple which slowly disappears. All these show that, say that there is pedal edema or swelling of limbs, lower limbs. And one more indirect evidence is that the slippers or chappals what we wear, shoes what we wear, become tight day by day. And one more very important monitoring system is checking your weight. Inadequate weight gain in patients with kidney disease, in patients with heart disease, in patients with cirrhosis, liver disease, say that they are retaining some amount of fluid, which can lead to pedal edema at a later stage. Moving on to the treatment of pedal edema, it is more specific to the common cause, what it is like. It can be because of various other involvement. It can be because of very simple causes of prolonged sitting, prolonged standing for a long time. So it is, we need to identify what are the causes for the pedal edema. Then it would be more easier to treat this pedal edema. And most common cause, most frequently identified, is the pedal edema, which is very much benign, is swelling of both lower limbs after a prolonged travel. So movement of your lower limbs, mainly during your travel, prevents pedal edema, which decreases the, which improves the circulation of blood into towards the heart. So there will be decreased pedal edema. Next, elevation of your limbs. If you identify some patients, if they identify that there is swelling of lower limbs, just elevation of their legs above the heart while sleeping, just elevation of their limbs while working for sitting in a sitting posture helps to decrease the swelling of lower limbs and improvement symptomatically. Next, usage of massage, usage of bandages. Usually in patients who have varicose veins or when there is venous insufficiency, who have deep vein thrombosis, help with bandages around the lower limbs, which increases the seepage of fluid from the legs towards the heart. So this, all these simple measures helps in decreasing the swelling of lower limbs. Next, coming to specific medication, specific treatment depending on the cause, or when there is heart, when there is kidney, when there is liver involvement, it is more specifically to reduce your salt intake in your diet so that the swelling of the lower limbs decreases and helps in treatment of pedal edema. And more specific measures for the treatment of swelling of lower limbs is physician specific, doctor specific, and you need to identify the cause for the swelling of lower limbs. If it is not decreasing by simple measures of elevation of your feet, simple measures of reduction of salt intake, because the cause decides what the treatment would be. The treatment would be some medication which increases your urine output and decreases the body water, which improves in decreasing the swelling of your feet. And ensure to ask the questions to a doctor that what are the causes for the pedal edema for them, what are the treatment availability, what should we know to decrease the reoccurrence of pedal edema, and what are the medical problems associated with this pedal edema. And lastly, more common, more frequent is reduction in the salt intake, doing some simple activities, and if the travel is prolonged, breaking the travel, having a movement during in between the travel, moving your lower limbs during the travel will prevent or decreases the pedal edema, which is more important and which can be detrimental if not identified. Thank you.